Hi everybody, I'm Dr. Ali Kareen of Kareen Pediatrics. I wanted to give a little update for my families with autism. This has been a really hard time, especially for my families who have more severe autism and children who are lower functioning and need a lot of support. And my heart goes out to you. I know your lives right now are really tough, and I wanted to give a little bit of advice as I've gone through this week talking to families of a couple things I thought about. First of all, if you have been approved for home health aides and you have had trouble in the past finding home health aides, now is the time. I have a couple things I've been thinking about, which is our summer programming may look gone or different, and so our need to have help in the home is going to continue, I think, for quite some time. The other thing is I know a lot of aides and intervention specialists who are actually very concerned for their population, and they're worried about your kids, and they're worried about how they're doing, and they don't have work either, but they are allowed to come into your home as home health aides. So if you have Medicaid or insurance coverage for home health for your children with autism, and you've had trouble in the past finding an aide to perform that job, now is the time to look for one. The first place I would start is if your child is enrolled in school, which of course is not happening right now, is to get a hold of the aide or aides in the past that you know your child really liked, who you have their numbers or contacts for, and ask them if they would like to be a home health aide for you and arrange that through your home health agency. Many of those families are doing that, and they're saying, wow, you know, my son John really misses Emily, who takes care of him at school, and frankly, Emily misses John. And so they are getting a hold of the aide that already knows their child and arranging that through home health aide to come into the home and help you educate your children and keep them safe. So that's one place to start. The other place to start is job boards, Facebook pages, community, just lots of things. There are a lot of people that love our special needs community who really want to help, and now is the time to maybe bring them in for the next 3, 4, 5 months until next year comes, and I don't even know what next year is going to look like. So we could continue to need our home health aides for the next year if they start doing half school or something in the fall. So I want you to think forward to anybody who doesn't have current home health aides, or maybe not enough, but you do qualify to start looking into getting them. And of course, we write those orders once you get that arranged. But unfortunately, it is your job to help arrange those. The other thing I wanted to point out is that if your children are due for blood work, it is the best time to go right now. There's nobody at the hospital, there's nobody doing anything, so now's the time to go. There's no COVID at the laboratories, the staff are bored, they've got lots of time to wrangle a difficult child for blood work or calm them down if they just need some extra encouragement. So this is a really good time to seek medical care in that regard. The other thing is sometimes we change diets, or we start new medications, or we do different sleep routines, and we can feel kind of too busy to choose a new behavioral thing to work on, like potty training, or the way we respond to bedtime or eating or whatever. And we are home a lot right now. So if we couple that help with the home health aides with some goals that a behavioralist like a BCBA could help you with, we could maybe get forward with some goals that are been difficult to tackle, and we can really work on them in this time. I've had a lot of families who are struggling because the school is sending home academic work, and the children are really struggling with doing academic work at home for a variety of reasons. And I just want to say that if your child is really struggling with very basic academic work that frankly is already well behind their peers, and we're just doing academic work because we're supposed to do academic work, take a break. This is a great time to work on life skills with your kids. Work on your kids with laundry, work on them with getting themselves dressed, work on self-hygiene, work on making their beds. We have lots of life skills for our children, especially with low functioning, that really need to be worked on. And this is like boot camp. We can spend a whole bunch of time on life skills right now that frankly in the long run will probably be more important for your child anyway. So take that hat off of trying to teach fractions. I talked to a mom yesterday that was trying to work on fractions with her son, and she said, "This is crazy." And I said, "This is crazy. Do not work on fractions." Let's work on eating and life skills and things that our kids really need. going forward. I think they'll enjoy it more. I think you'll enjoy it more. And really, frankly, in the long term, they'll always use those skills, and they probably will not use fractions. So if you have any questions, of course, we're available for individual appointments on telemedicine and things that you might want to tackle and get some advice on how to tackle them. We are here. We are doing telemedicine appointments for that. I love seeing my kids on telemedicine. They run up and they're like, "Hi, Dr. Kareen." And that's been really fun. And so contact us if you need us. And I hope this time can turn into at least something that you feel like you can accomplish with goals for your children. Take care and be safe.